Hi there, we're so glad you're joining us today for our first ever virtual event for Community Oncology Alliance and Community Oncology Alliance Patient Advocacy Network, otherwise known as COA and CPAN. Our chapter started here in March of 2015, and we're glad to be able to come to you now on this virtual format. My name is Brenda McGarr. I'm the Oncology Nurse Navigator here at Augusta Oncology, and I'm also the CPAN Advocacy Chapter Leader for our chapter here. I have with me today Dr. Miriam Atkins, who is one of our medical oncologists here at Augusta Oncology, and she's also the CPAN Medical Co-Chair. So again, we started in March of 2015 with the Community Oncology Alliance chapter here at our practice at Augusta Oncology. And if you're not familiar with COA and CPAN, it is an international organization to advocate for your rights as the patients in community oncology. We do many different events. We do locally here. We used to have monthly meetings. However, because of COVID, we've had to change that. And now we're going to do the virtual meetings instead, at least once a quarter and maybe more often. We also have international conferences that, again, used to be live, but now have turned into virtual events. We also have taken many trips to Capitol Hill. Dr. Atkins herself has been there many times to meet with congressmen and senators and advocate for you, the patients, and the patients' rights. So it's a very active group. We would love for you to join us and become a part of that as well. We will list the websites later on in this presentation where you can go online and join. It's absolutely free. It gives you a chance to see what's going on in the realm of oncology and medical oncology, specifically community oncology. And even if you're not the patient, if you're the caregiver or the family member, this is a great way for you to advocate and help the patient as well. So we would encourage all of you to get involved with that. Next slide. So today we're going to talk about the topic of white bagging and brown bagging. And I'm sure you're probably going, well, brown bag is what you put your lunch in. I'm not sure what a white bag is, but we're going to give you a little bit more detail and insight on that. Dr. Atkins is going to go over that in just a minute for you and give you some more information on that. But again, I would just like to encourage you to get online, sign up, become a part of this. We do have our events quarterly as well as monthly events that are sponsored by the COA on the international level. So, Dr. Atkins, we'll let you begin. Oh, excuse me, national, not international. I'm going worldwide with this.
You go worldwide.
Yeah, I'm taking it everywhere. National, excuse me. So Dr. Atkins, if you will, I'll let you talk about it.
Sure. Good morning. Thank you for joining us. I'm Dr. Miriam Atkins. I'm a medical oncologist here at Augusta Oncology. I am the medical co-chair for CPAN, and also I'm the secretary for the Community Oncology Alliance. So I've been in oncology for over 25 years, and I've seen a lot of changes. And there's several threats. One is the white bagging and brown bagging policies that put patients at risk. So many patients don't know what this is, so we'll go through it. So we kind of say the white bagging is when the insurance company wants the drug to be sent to us from their distributor. So as an oncologist, we either use our in-house pharmacy or a trusted supplier to get all of our drugs. We trust them, we know the manufacturer, we know where they come from, we know how they're handled. But insurers are trying to mandate policies where they will mail us the drug. And this has a lot of problems, and we'll go through some of those problems later. And a lot of these problems can be very dangerous to patients. The next is brown bagging. As we mentioned, as Brenda mentioned, you think of a brown bag as your lunch. So most patients, their first exposure to cancer medication would be in the office. And then insurance wants to mandate brown bagging. That would be a third-party pharmacy would mail the drug to the patient. Then the patient is responsible for bringing that drug in, keeping it safe, storage, and that just gives the patient one more thing to worry about with their cancer care that they don't need to have to worry about. So what these two policies do, white bagging and brown bagging, forces oncologists to get medications from third parties that are disconnected from the practices of patients. This puts an unnecessary burden on patients to manage their own cancer care. As I mentioned before, any patient with cancer has a lot to deal with. They don't need to deal with getting their chemotherapy, bringing it in, making sure they didn't leave it in the car, those sorts of things. This also makes it very difficult for oncologists to adjust the doses and treatment in a timely manner. For instance, when we mix the drugs here, I see a patient, I check the labs, I make sure the patient's okay, I make sure there are no changes that need to be made in the patient's medication or the dose. If a drug is sent to me from a third party, the drug is already mixed. So if I want to lower a patient's dose, I can't just take 10 cc's, 50 cc's out of the bag and think that's the right mix. Also, if I can't treat the patient that day, I have to toss the medication, that's a waste. If I have to mail the drug back to where the drug came from, that further delays the patient's treatment. Therefore, these policies are can be detrimental to patients. So the implications, as I mentioned, one, the delivery. If we don't have control of the medication, the treatment safety is jeopardized. We don't know where the drug sat. Many drugs require specific temperatures, and there actually was an article published in one of the journals this week about how many drugs need a certain temperature. So we've had patients who had drugs that were delivered in the summertime, and this is specific, one patient had an oral agent that needed to be kept at 75 degrees. Well, the patient brought the drug in, and we put a thermometer in there, and the temperature was 110. So now we have a drug that may not work anymore, it may not be viable. These changes may actually hurt a patient. Then with the treatments, I have less control. I'm trying to have more control to take better care of my patient, adjust doses as needed, and make these changes real time. And also, some of the other implications patient care suffers when this happens. So the Community Oncology Alliance opposes white bagging and brown bagging. We strongly oppose interference with the physician and patient relationship and the cancer treatment. And cancer physicians and patients have to have confidence in where the drugs are coming from, how they're managed, how they're prescribed. When a medication is mixed here in my practice, I know my pharmacy tech who's mixing it, we know how it is mixed, we know it's properly done because we're also responsible. So these policies must change to keep community oncologists in control of our cancer medications. We need our policymakers to oppose white and brown bagging and return control of drug fulfillment to oncologists and the practices. The policies must keep oncology physicians in control of cancer medications and treatment. The policy makers need to oppose white and brown bagging and return control of drug fulfillment to oncologists. Medical professionals who directly treat patients should control cancer medications, not insurance company bureaucrats. So we need to take action. We do everything we can to take action. As Brenda mentioned, we go to Capitol Hill to lobby Congress, lobby the Senate, but there's also things that patients can do because your voice means a lot to your representatives. You can go on the Community Oncology Alliance page and see our position statement and tell your policymakers to end white and brown bagging practices to keep patients safe. So here's a sample of some of our advocacy events. We had one yesterday with Dr. Kashyap Patel. He's the Vice President of Community Oncology Alliance, and he is one of the physicians at Carolina Blood and Cancer Care he's in South Carolina, right outside of Charlotte, North Carolina. And then here we had our virtual Community Oncology COA Advocacy Network Summit, which went very well. It was virtual this year for the first time. We had a great agenda, and we're going to do this virtual again next year.
All right, thank you, Dr. Atkins.
You're welcome.
We appreciate your information. And again, reach out to us at the practice. If you have any specific questions for Dr. Atkins or I, you can always email us here at Augusta Oncology. And as well, please, if you're not already a part of COA and CPAN, we encourage you to join us in this fight. Thank you so much.
Thank you.